When it comes to knee pain, there are a lot of different treatment options out there. And if surgery is something that you're considering, then our next guest has info on minimally invasive procedures that you'll want to hear about. And to explain from ProLiance Orthopedics Associates is Dr. Timothy Alton. Welcome to New Day.
Thank you. Happy to be here.
Yes. So before we get started, tell us about what you all do at ProLiance Orthopedics Associates.
Yeah, ProLiance Orthopedic Associates is a private practice of orthopedic surgeons. There's about a dozen of us, and we're down south in the Renton area. We cover everything from hip and knee replacements to back problems to hand, foot, and ankle. So all orthopedic problems we take care of down south.
Amazing. And tell us about these latest advancements in robotic and minimally invasive surgeries. This is so cool.
Because this is something I'm really passionate about, is helping people get back to doing what it is that they love to do. And one of the ways that we do that, and one of the ways that I can help people, is by hip and knee replacements, where you think of your hip and knee joints as like the tires on your car, and then you put 100,000 miles on those tires and they wear out. Same thing happens to our joints. And when that happens, it hurts and people can't do what they want to do. So a joint replacement or a hip replacement or a knee replacement, it's like putting new tread on the tire for them. We have all these really cool techniques and technologies now that allows us to do it in a muscle-sparing, minimally invasive type approach. So for a hip replacement, we go from the front, or an anterior approach. I don't cut any of the muscles, just pull them to the side. We use x-rays and computer programs and all this tech to get the parts in just perfect. Similar thing for knee replacements. Traditionally, we would cut into the thigh muscle.
Yeah.
We have a way to do that where I don't cut into the thigh muscle. It's a muscle-sparing approach. We call it a subvastus, or a minimally invasive approach. And by doing that, it hurts less, people bounce back quicker, and we even use robotic technology during the operation to get it so that the preparation of the joint is just perfect, within like a half a millimeter of what we're trying to accomplish. And so we put all of those things together, muscle-sparing approach utilizing technology. We can perform these knee replacements, get it right the first time, get people through it easier than it used to be, and have these implants last for their whole life.
Gosh,
really exciting.
That is incredible. I can feel your passion. It's exciting. And tell us about your patient-reported outcome measures. I understand the national average for patient satisfaction at 1 year is approximately 80%, but your patients report satisfaction scores of 96% at 1 year. That's obviously exceeding and outperforming the national average. So congratulations on that.
Yeah, thanks. It's something that we take really serious at ProLiance Orthopedic Associates, and something I'm really passionate about is providing the best quality care possible to our patients. And by combining really good implants, these muscle-sparing techniques, and a really cool center where we can do these operations as same-day surgeries, we put all of that together, and we are seeing these really outstanding outcomes for patients. And it really helps to be able to show them data to support how well they're going to do, because people are usually a little apprehensive to have an operation, understandably so.
Yeah, definitely. And tell us about the benefits. You talked about the surgery center.
Yeah, so we have what's called an ambulatory surgery center, which means it's a standalone facility. It's not a hospital. Patients aren't sick there. They're coming in to get their joint replacement. So we built this a few years ago with this in mind, is to provide orthopedic only care to our patients. So you come in the morning, you have your joint replacement, and then you're home later that day, recovering in your environment and starting your rehabilitation in a place where you're comfortable. You're not staying in a hospital with sick people. You're just getting your joint replaced and home you go.
Oh, I like that. Okay, and what other services do you all offer? I understand urgent care is there and so forth.
Yeah, we have an orthopedic only urgent care. So if you sprain your ankle, twist your knee, have some sort of an orthopedic issue, you don't have to go wait for all these hours in an emergency department, but you can come to our urgent cares, there are a bunch around town, and get an orthopedic specialist to see you straight away. So in addition to hip replacements and knee replacements and foot and ankle, we also have an urgent care that we're proud of.
Gosh, amazing. Thank you so much for this information and joining us today. This was great.
Yeah, thanks for having me.
New Day Northwest is sponsored by ProLiance Orthopedic Associates.